Welcome to The Skin Reel, your guide to all things skincare, skin health, beauty, and more, curated by dermatologists and true skin experts. I'm your host, Dr. Mary Alice Mina. I'm a double board certified dermatologist and dermatologic surgeon with over a decade of clinical experience. If you're looking for real, practical, unhyped skincare guidance and expertise, or you just think the skin is really cool, then you're in the right spot. I'm so glad you've tuned in to The Skin Reel. Now let's dive in because this is how dermatologists talk skin. Hi everyone, quick disclaimer here before we start. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. If you're looking for help on your skin journey, please check out the American Academy of Dermatology's website, aad.org, where you can search their database for dermatologists near you. It is so important that you have someone in your corner who's well-trained, licensed, and board certified who can help you make decisions when it comes to your skin health. Okay, got it? Great. Now for the fun stuff. Hi, everyone. Thanks so much for joining me on this week's episode of The Skin Reel. This week, I am going to be talking about probably my most favorite and most beloved skincare product, aside from sunscreen, and that is a retinoid or retinol product. Most of you have probably heard about retinols and retinoids. And if you're like me, when I first learned about them, it's really confusing. And you're wondering, what is that? What am I supposed to call it? What's it used for? And what does it do? So on this week's episode, I'm going to break down all of that for you so that you know about this mighty little skin cream that really packs a punch. So what are retinols and retinoids? And I am going to use that term interchangeably, but just so you know, these are both vitamin A products. Vitamin A is really important in skin cell turnover and collagen formation. And we use it in kids with acne, and then we use it in people for its many anti-aging properties. The other great thing about these vitamin A products is that you can find lower strength ones over the counter, and those are going to be your retinols. And you can also find higher prescription strength products from your dermatologist, and those are going to be your retinoids. Commonly, what's prescribed is something called tretinoin. So we use these retinols and retinoids topically on the skin. And the reason why we use them and the reason why they're beneficial is that they actually promote cell turnover. So our skin cells go through a cycle of cell turnover about every 3 weeks or so, give or take. And with a vitamin A product, it increases that cell turnover and sort of sloughs away the dull, dead skin cells on the surface that make your skin dull and can also clog pores. And that's why we use these products commonly for people with acne, because not only does it increase cell turnover, but it also helps open up and unblock these pores, which are called comedones, which are the root cause of acne. Tretinoin also increases collagen formation. And this is so important with anti-aging because even in your 20s, your collagen production starts to decrease. So anything we can do to help boost that and build it up is really, really important. Now, if this sounds too good to be true, let me reassure you, this is not hype. This is not gimmicky. This is all science-backed by really good research studies and data. So this is one of those products where I usually say if it sounds too good to be true, it is, but this is as close to a magic cream as we can get with anti-aging and aesthetics in a cream formulation. The key with using these retinols and retinoids is not to overdo it and to start slow. That's because these products will irritate your skin and dry your skin. So I like to tell my patients when they're starting to just use a pea size amount to cover your whole face. So that's not a lot. If you're using more than that, you're probably just getting more side effects and not really getting any more benefit. You want to wash your face at night with a gentle cleanser. If you're using a retinol or retinoid product, you really don't want to overdo it with exfoliating because the product is going to be doing that for you. And if you're using too many exfoliants and alpha or beta hydroxy acids, it can be too much for your skin and it's going to be irritated. So if you are using this product, gentle cleanser, pat your skin dry and really let it dry for about 30 minutes and then take a small pea-sized amount and cover your whole face. You also can use this on other parts of your body. So you may want to go ahead and put it on your neck or on the décolletage of your chest, which is kind of the area of your chest that shows with like a standard V-neck shirt. You also can put it on the back of your hands. For some people, especially if you have very sensitive skin, you may want to go ahead and mix a moisturizer with your tretinoin. Just know that you are basically diluting it and it won't be as strong or as effective. Alternatively, you can just use the product less frequently. Maybe when you first start out, especially if it's in the winter, you may just start doing it once a week or even twice a week. And I will tell my patients, especially when they're using a prescription product, look, the goal is to start slow and build up. And once you're using this product essentially nightly with minimal side effects, then I tell them to give me a call and we'll increase the dose if needed. If you're using a retinol or retinoid product, this really should be the only thing you put on your skin at night. You don't need additional serums when you're doing this, aside from perhaps a moisturizer if you have pretty dry or sensitive skin. When you wake up in the morning, most people will want to at least splash some water on their face or use a mild or gentle cleanser before they start their day. And again, use something mild. Let the retinol, let the retinoid do the exfoliating. Don't also aggravate your skin by using a lot of physical or chemical exfoliants as well. After you've been using your retinol or retinoid product for even a couple of days or a few weeks, you may notice that your skin is dry in the morning. And I know when I use my product, especially around sort of my mouth and my chin, can get pretty dry. So what I recommend for patients is to use a thicker moisturizer in those areas in the morning when they're putting on their sunscreen and their moisturizer, and to either avoid that area in the evening until the drying improves, or to mix with a moisturizer when they're putting their retinol on at night. And just know that a little dryness, a little flakiness is normal. That means the retinol and the retinoid is working. What we don't want is for the skin to be super irritated and super dry. Then you want to back off and bump up your moisturizer. A lot of times these retinol products can be mixed with other ingredients, especially if you are buying it over the counter and not in a prescription formulation. And you just want to be careful that it's not being mixed with other ingredients that are going to be overly drying on your skin. You do not want your retinol mixed with vitamin C serums. And you want to use your retinol and retinoid at night because it will make your skin more sensitive to sunlight. And so again, use it at night before you go to bed, not first thing in the morning. That's when you want to be putting on your vitamin C if you use it, and your sunscreen, of course, every day. So some of the common questions I get about retinols and retinoids is it safe? It is a very safe medication. We, again, use it in kids who have acne, and it's really, really effective. I also start recommending it even for my patients in their 20s to just kind of get in the habit of using this as your nighttime anti-aging cream. A lot of times this product, especially if you get it from a dermatologist or as a prescription, can be anywhere from $50 to $65, and that can last you a long, long time. So again, I say you get a lot of bang for your buck using a retinoid product. It really is a wonder cream. It will, again, help with cell turnover, remove dead skin cells. It will improve pigmentary issues that someone may have and give you a more even, uniform complexion. It will improve your skin tone and texture by improving collagen, and it will prevent acne. So it really is an amazing product and really my go-to evening anti-aging product. I would say hands down second to sunscreen for anti-aging. But it does have side effects. And again, just because one product gives you dryness or irritation, I don't think you should write off all retinols or retinoids. You want to talk with your dermatologist about maybe finding a formulation that is either less strong or perhaps not mixed with certain ingredients that may compound the irritation. So again, don't just swear off all retinols and retinoids. Really talk with your dermatologist about finding one that would be a good fit for your skin type and skin needs. You want to start low and slow, so a low concentration of retinol or retinoid, and use it only a couple nights a week until you build up tolerance to it. Really, the only patients I would recommend avoiding a retinol or retinoid product would be someone who is pregnant. And that's because vitamin A, at least when taken orally, can cause severe birth defects. And vitamin A, when taken orally, is known as isotretinoin, which is a prescription treatment for people with moderate to severe acne. Now, these birth defects have not been found when people use the topical formulation, but in an abundance of caution, I would just recommend pregnant people or someone who is trying to get pregnant avoid a retinol retinoid product until you are no longer pregnant or planning to start a family, just to be extra cautious. Now, I also tell people when they're using a retinol or retinoid product that it's kind of like weight loss. It takes a while and you have to keep at it. It's not going to happen overnight. You can't expect to put it on once or twice or even for a month and expect to see these dramatic results. It really takes 6 months, even 8 months to really see the impact of doing it. So don't get discouraged. And again, stick with it. Start low, start slow, and your skin will really reap the benefits of this amazing vitamin A cream. Thanks so much for joining me, and I will talk to you next week. Thank you so much for listening to The Skin Reel. I hope it's been informative, educational, and perhaps a little entertaining. If you enjoyed this podcast, be sure to like and subscribe and share with a friend. Don't want to stop your learning just yet? Head on over to theskinreel.com for show notes, blog posts, and so much more. Until next time, skin friends.